Hello, kidney warriors. James here from Dadvice TV, your online kidney health coach, and this is Dadvice TV Live. For those of you who are joining us for the very first time, welcome. It is great to have you here. You're going to find Dadvice TV very helpful as we focus on interviewing industry professionals to share real science-backed information. None of that woohoo, magic cures, none of those things, because those are all fake. This is all the real stuff. Now, my co-host today is someone you guys all love, all of you regulars. It is the author of the book, Learn the Facts About Kidney Disease, Dr. Stephen Rosansky. And let me tell you guys, I say this every single time. This is the book, in my opinion, that every kidney patient needs. When you are diagnosed with kidney disease, you are scared, you are confused, you go online the internet, and there is so much misinformation, so much scary stuff out there. You don't know what to do, and you're afraid to eat anything. You don't know what you're supposed to watch. What does it mean when you look at your labs? Should you be worried? This book answers those questions. It takes all those worries off your shoulders so you can focus on being proactive on getting control of your kidney disease, working with your doctors, knowing what you should be focusing on to eat, and knowing when you really should worry. And probably the most important thing is when you should not be on dialysis, because too many doctors are starting dialysis too early. But this is a book that I wish everyone was given when they were diagnosed, and that is who my co-host is, the author of Learn the Facts About Kidney Disease. Now, tonight we're going to be talking about potassium and kidney disease. So let's go ahead, let's bring on Dr. Rosansky and get right, excuse me, it's allergy season. All the trees are starting to bloom and the flowers, so my allergies are getting to me a little bit, so I might cough from time to time. But please welcome probably the favorite co-host here on Dadvice TV, Dr. Stephen Rosansky. Hey, Doc.
Hey, James, how are you doing?
Hey, doing great as always.
So, yeah, I guess you want me to introduce myself, give you a little background.
Mm-hmm.
Yeah, so I'm a retired nephrologist, kidney specialist, and I've taken care of kidney patients like you viewers for over 40 years. And I love sharing my knowledge with you folks. I've done a lot of teaching to medical students, medical residents, other doctors, and I've done a lot of research and published a lot of original work. And my work was recognized as being very important regarding the issue of when to start dialysis, among other things. And I love giving this information to you folks because you know what you can get from these shows that I do on Dadvice TV is basically a course on everything you need to know about the kidneys and renal disease. And today we're going to talk about something that a lot of folks who have something wrong with their kidneys worry about. They worry about their potassium, and we'll get into what you should or shouldn't worry about, what levels are important, and how you manage it. So if you are ready, we can get right into it, James. And I'm going
Yeah,
to test you on a lot of stuff.
and for everyone out there, this is a live show. If you're watching on Monday, April 10th, 7 p.m. Eastern, we are live. So type in your questions, and near the end of the show, Dr. Rosansky leaves a little bit of time to go back and answer some questions, and we may be able to answer them during our conversation. So I look forward to seeing all of your questions in the comments. All right, Doc. Now, don't be too hard on me. I got my allergies I'm dealing with, and I took some allergy medicine, which makes me a little sleepy and slower to answer. That's my
Well,
excuse.
I think you know most of this stuff. I'm sure I would guess you know. So first of all, uh, potassium. It's one of the electrolytes. If you get your blood test done, and you'll see your electrolytes, and you'll see your creatinine, which is how they get your EGFR, your kidney number. But potassium is one of the electrolytes. And where is most of the potassium in the body? Is it in the blood or is it in the cells of the
I'm
body?
going to guess in the cells, and I'm
Absolutely.
guessing.
That's a good guess,
Okay, cool.
because it's about 140 the level in the cells, and about 3 to 5 the level in the blood. So there's not much in the blood. Most of it is in the cells. And that's why when we try to manage patients that have high potassium, we try to shuttle that potassium back into the cells that's in the blood. There are things that you can do to move the potassium. So, what does potassium do in the body? Any idea why potassium is an important electrolyte? What is it important
Well,
for?
I know it's important
Yeah.
for your heart to beat, be healthy. Um, and doesn't it help manage, is it calcium or something else that helps manage, right? There's a balance.
You're thinking of calcium, and we're going to get into that, but it doesn't manage the calcium. But what potassium does is it's important for your muscles, your nerves, and all muscles, skeletal muscle, heart muscle. Potassium is very important for your muscles to work. And you're going to see why in a minute when we talk about having problems with low or high potassium. And, clinically, if your potassium levels are too high or too low, your muscles aren't going to work right, which can result in a lot of bad stuff. So here's another question, which I just recently learned. What's more
Uh-oh.
common in kidney patients, high potassium or low potassium?
So I would guess high potassium, but if you just learned it, everything out there is about high potassium. So is it low?
It's about, if you've got CKD, your chances of having high or having low potassium are about the same. How do you like that?
Ah,
Which I thought was very interesting.
yeah, there we go.
Okay. Now, what do the kidneys have to do with potassium?
Well, they manage the electrolytes, don't they? How much is in the blood? And when there's
Exactly.
too much, send it out to the
Exactly.
urine.
Exactly. Exactly. The kidneys are very, very good at managing your potassium level. If they weren't, we'd all be in big trouble. And the kidneys can get rid of 90% of what you eat, and they can adjust the amount of potassium that's going to go out in your pee depending upon your diet. And that even will continue at even to low levels of kidney function. So those of you, most of you, from what I've learned, being on the show quite a bit, are CKD3. EGFR is at 30 to 60. And it is highly unusual for people at that level of kidney disease to really have to worry about having dangerously high potassium. It becomes a lot more of an issue when you get to be CKD5, less than 15 EGFR. And if you're in that stage, you're more prone to having an elevated potassium. Now, when do you get symptoms? At what levels? And this is a question that's come up on other shows. What levels, high level, what level, low level, do you need to start being concerned? Let's start with the high level. Should you be concerned with a 5 or a 5.5, which a lot of people get worried about? Is that something to be concerned about?
So I know my last lab, mine was a 5.5, and the doctor just told me to eat less potassium, but didn't put me on any medication or anything. He says you're at the high end. You need to pull back on those baked potatoes and things like that, and avocados.
Well, I don't know that I'll agree with you, doctor, and we're going to get back into that in a little bit. That's something to bring up in a few minutes. So high is over 6. Okay, if you get up over 6, that's a moderately concerning potassium, and if you get over 6.5, that's a significantly concerning potassium, over 6.5. And when is a low potassium a serious number? At what level do you start worrying about low potassium?
I have no clue, but when I was diagnosed with kidney failure, mine said critically low,
Wow.
and I think it was zero point 0.8 or 1.8. It was a very low
Ooh,
number.
you could be. paralyzed at that level of
Yeah.
potassium.
They went 2 bags of potassium through IVs and it burnt my
Wow.
arms and shoulders. But it said critically
Wow.
low, whatever it was. It was is there 1.8 or 0.8?
No, it wasn't. Wouldn't be 0.8, and 1.8
Yeah, maybe it was
would
1.8.
be critically low. And we'll kind of try to get back into your diagnosis maybe towards the end of our talk, because that's really interesting, James. So less than 3. So the normal range, which I didn't give you, 3.5 to 5, 3.5 to 5.2. Okay. And one thing that we've said over and over again is you may get an EGFR level. If you repeat it again, it may be different. Hello, same for potassium. Just because you have one potassium, like James said, the last one he went to was 5, he said 5.5.
Yep.
If your doctor rechecked it, it may be back down to 5. So those potassium, like all other laboratory values, are going to vary, and you need to repeat any abnormal value. That's my rule of thumb. You got an abnormal value, repeat it, make sure it's really a problem. Now, which is more serious, would you think, James? If your potassium goes up quickly or goes up chronically elevated? Are you in more danger if you have a high K going on for a long time, or if you have a high K that just happens?
I'm going to think for a long time since it impacts muscles.
No,
Ooh.
got that wrong. And think about yourself. They were going crazy because your K was low, and it wasn't low, or it could be the same, low or high. It wasn't low for a long time because you would be very symptomatic for a long time, and you would not,
Ah.
and you could die. Bottom line, your potassium level gets high enough or low enough, you can die. So it's the rate of change. If you get a fast change in your potassium, either way, you're in trouble. That's when you're
Mm.
really in trouble. Not the people, and not as much if your potassium is. I have had plenty of people with potassiums over 6 for years and years and years, and then we can talk about how I manage them. But if they change quickly, you got problems. So what do we do? And what so if we got a situation like James 1.8 or some other patient out there who's got a 6.8, okay, a high one or a real low one, what do you got to do? Well, we're going to talk about the high one first. First thing you do is get an EKG. Why are we getting an EKG? What are we worried about, James,
The heart.
specifically? And what specifically can happen if your K gets up real high?
Would it be a heart attack?
Ventricular tachycardia or ventricular fibrillation, a cardiac arrest.
Mm.
And I've had patients that have done cardiac arrest because of high potassium. And what you do if you get a K over 6, got to send the patient to the emergency room, got to get an EKG, see if the EKG is showing any changes. And there are worrisome changes that you follow on EKG before you get to the severe ones that lead to cardiac arrest. So you look at the EKG. And what you're going to do is you're going to take advantage of the potassium shuttle. Like I said, most of the potassium is in the cell. And you can shuttle the potassium back into the cell. So how do we shuttle potassium back into the cell? Any idea?
Is it a medication?
There are medications that can do it, and there's medications that can do it. Any idea?
No clue. I've
Okay.
never had a problem with it being too high.
Okay. All right. All right. Well, we're going to get to too low in a little bit. So if it's running high, and if there's any evidence of your EKG looking uh, bad, you get different changes on your EKG. You want to shuttle the potassium back into the cells, and you can do that by giving bicarbonate, because if you have a more acid in your blood, potassium comes out of the cells. If you've got less acid in the blood, potassium can move back in the cell. The other thing that pushes potassium in the cell is insulin,
Oh.
because insulin will take your sugar and push it into the cell to metabolize it with potassium. The other thing that some patients have done for an emergency, with high K is take the breathing drug, the albuterol. That can help push potassium in the cell. Now, what you were getting at a little while ago is calcium. And I don't know if you were given it for this reason. Calcium can be the lifesaver. If your EKG is starting to show changes from your potassium, that calcium can stabilize that muscle membrane to keep you from going into fibrillation. So that's where the calcium comes in.
Aha.
You were on the right track, but just not
I
quite.
have read so much information, it all gets confused in my head over time.
It's confusing, yeah. But hey, you're learning a lot, and you're going to continue to learn, James. This is
Yep.
great.
Now,
Now,
when you
okay,
said the bicarbonate, is that where they use the sodium bicarbonate pills, or are there bicarbonate without the sodium?
no, it's sodium bicarbonate. It's sodium
Okay.
bicarbonate. Yeah. Now, and I'm going to digress just for a second. There is research going on to see whether or not sodium bicarbonate, in addition to other things that we've discussed, can slow decline of kidney function. Jury is out. But generally speaking, I recommend for patients whose bicarbonate on their electrolytes, if it's low, to go ahead and get on bicarbonate. Probably won't hurt, and it may help slow decline of kidney function. All right.
And a low is a 21, correct?
A low is
Or
below,
lower?
let's say 22. 22, 25 is a normal range. 25 is, what
Okay.
you hope for. But if it's below 22, 22, you probably start taking bicarbonate. Now, let's go on to the situation where your potassium is elevated long term. If someone's coming in and they're having trouble with their potassium, what's the first thing that the doctor should do or you should be thinking about? What's the first thing to check? Which would go along with exactly your recent situation.
See, I am always worried about the heart.
Right.
And that's
But
what always comes to mind is the heart for me.
well, you want to check the medicines because there are
That's right.
medicines, including the one you're on, James,
It's a potassium sparing one. That's right.
can raise your potassium. And tell me the medicine you're on that can raise your potassium.
I do not remember which one it is.
Okay. Aldactone. You're on aldactone, I think.
Aldactone? Oh,
I
hold on.
think
Let me bring up my list. I
okay.
just got them refilled yesterday, and it is so complicated putting them in the right bottles with on the caps. I write when I take what. And let's see. I have. Darn it! I have not updated this on here.
All right. Well, let's go
my
on
pills are.
other medicines. So there are drugs like potassium-sparing diuretics, like aldactone, that can raise potassium. What are the other common drugs that elevate your potassium, James, that we've talked about over and over? Two
It's
classes
not
of
the
drugs.
Aces and Arbs, is it?
It is. Of course it is. Of course it is. The Aces and the Arbs, the drugs that are so important to slow decline of kidney function, can also raise potassium. That's important to know. And we're going to get into that in a second. Other drugs that may raise so I don't know. So if you're going to your doctor, your potassium is a little bit high, one of the first things to consider is can you get rid of some drugs or not, that are raising potassium. Things that you probably could get rid of are NSAIDs. The Motrims can raise potassium. Yeah, so that's another drug. And then any people out there are that are getting transplants, cyclosporin, tacrolimus, they'll know those drugs. They can raise your potassium. The other thing, which is ironic, is that there are people that have elevated potassium that have been given potassium pills because they're on a diuretic and they lose potassium, right? And the doctor doesn't even check, and they continue to take their potassium pills. So you may have been given potassium pills, but if your potassium is already back up to high levels, you got to stop them, obviously. But this happens, James. This happens. And another thing that happens is that people want to avoid salt. So what do they take? They take a salt substitute, which contains what?
Potassium.
Sodium chloride or salt and potassium chloride.
Yep.
Okay. a common way to get your potassium up. And people, you need to be asking patients about that. The other thing that's common with high K patients, common in diabetics who have trouble with low aldosterone. If your aldosterone is low, that's the hormone that works on the kidney to get more sodium out in the urine and get more potassium in the blood. So if your aldosterone, aldosterone reabsorbs sodium and excretes potassium, right? Aldosterone reabsorbs the sodium, right, and excretes the potassium. So if you don't have aldosterone, you get trouble getting rid of the potassium. So low aldosterone or drugs that mess with the aldosterone can increase your potassium. Now, how do you treat people that are having trouble with elevated potassium? What would you think is the first thing to do? Which is probably what most of the patients and the folks watching this think they should do.
Well, would it be diet? Reduce potassium in your diet?
That's the first thing that happens, which is not the first thing to do. The first thing to do is to consider what could be elevating it and get rid of the things, if you can, that are elevating the potassium. The next thing you do is you can use drugs that may help the patient, that may help any of your viewers who have high potassium. They want to get it down, but they got high blood pressure. So use a diuretic that will get rid of potassium in the urine.
Ah,
So you can use thiazide diuretics or chlorthalidone or even things like Lasix, loop diuretics. They will help get the potassium out in the pee. There's a very good reason why I'm not jumping to restricting dietary potassium, which is, in my opinion, the wrong thing to do for the majority of people that have CKD and have, a mildly elevated potassium like you just had, James,
mm-hmm.
like your doctor just found on you. So water pills, get it out in the pee. And by the way, I think you're on a drug that raises potassium, but we won't
I
get into your.
am. One of them that they
Yeah,
added me on
yeah,
raises potassium.
yeah. So maybe you don't need to be on that drug anymore. That's the first thing. Again, don't stop your dietary potassium, and we're going to get into that in a minute. Okay.
Now, by using a diuretic, that means I don't have to take it with my food, like if I was taking a phosphorus blocker, which
No,
you
no,
have to
no, no.
take right before your food. With a
Nothing.
diuretic, I can take anytime, right?
Diuretic is working on the kidneys to get
Yeah.
more potassium in the pee. It's working on the kidneys. You don't have to worry about your diet.
Yeah.
Um, so you use diuretics, and you want to, like we talked earlier, if you have a low bicarbonate, you have called metabolic acidosis. If you correct that, that'll help with a high potassium. And ironically, for those people who are constipated, if you can get your fiber and your bowels moving well and laxatives, that can also, believe it or not, help your potassium. So there's things to do before we decide that we're going to restrict potassium. Now, and then there's something else even more important, especially for our population. There are drugs that can slow decline of kidney function, and there are drugs that can decrease death from heart failure, help you live longer. And these drugs we mentioned a little bit, and we're going to mention them again, can raise their potassium. And I'm going to get into something that's a little controversial, but try to follow this. Depending on your risk of dying from heart failure, getting kidney failure, because you've got what? High levels of urine protein. Remember,
Mm-hmm.
it's the high levels of urine protein that predict who's going to go to kidney failure, right? If you're one of these folks that are at high risk, you may not want to stop these drugs that are raising potassium. Now, let's go over them real quickly. The drugs that can help people live longer with heart problems, can slow the decline of kidney function by decreasing protein in the urine. what are the major drugs that also can elevate the potassium? We just mentioned them. We're going to give the list of them right now.
That's the
First,
Aces and the Arbs, right?
you got it. You got it. So again, we've done this ad nauseum. The aces end in pril. The arbs end in tan. Lisinopril, losartan. Okay, we're not going to give you the
And
whole
you
list
take
tonight.
one or the other, not both.
Exactly, James. You're right on. Right on. Exactly. Uh, the potassium-sparing diuretics that have either triamptorine or aldactone, they both have the spironolactone. They
That's
have
the one
the
I take.
spironolactone. You're on spironolactone, right? So these drugs, the aldactone, the triamptorine, the spironolactone, there's more. There's eplerenone, there's finerenone, a new one. These drugs can slow decline of kidney function and may have cardiac benefits. Certainly, the ACEs and the ARBs we know have cardiac benefits and have kidney benefits. They'll decrease your risk of death and decrease your risk of maybe having to go on dialysis. So, risk benefit. If you are a patient that's at risk for one of these issues because your kidney function is declining quickly or you've got heart problems, your doctor may want to continue those drugs, even though your potassium is starting to inch up. Another situation, if you have a heart attack, you're usually told to take a beta blocker to keep you from having what they call ventricular tachycardia or fibrillation, having a bad heart rhythm, which can kill after a heart attack. Beta blockers. But beta blockers are another type of drug that can raise potassium. But again, these drugs may save your life. So you got to be thinking about risk benefit. So, how do we deal with that? Some folks are saying for the folks that you need to continue the drugs, that maybe they should be on something called what, James? You know the kind of drugs that we're going to talk about next that will help lower your potassium?
Do not know.
Potassium binders.
Ah,
There are drugs that are called potassium binders. And what they do is when you take these drugs in your gut, they tend to grab onto potassium and it comes out in the stool. And the oldest example of these drugs, which I've used on dozens of patients, maybe hundreds, I don't know, certainly dozens with high potassium, is K-Xlate or sodium polystyrene, K-Xlate. Some of your folks that are listening may well be on it. It's an old drug, been out since 1950s. I've used a ton of it. But because there was a rare bad side effect related to the bowel, which may have been related to how it's used, it's given with sorbitol. Uh, a couple of other companies have newer potassium binders. So I'm still good with sorbit. I'm still good with K-Xlate. And you can be on 30 to 50 grams a day, and that may keep your potassium just fine, just fine. And the other ones are a new one that came out in 2015, Valtessa or Patiramir, and the one that's most recent is Zirconium, came out in 2018, or Lokelma. These drugs should be considered. Any of you folks out there that are having potassium problems, but may be at risk for the things we just talked about, you may want to discuss it with your doctor about maybe being on a binder. So you notice that decrease in potassium in your diet is not first choice. Now, those people with chronic potassium elevation, before I go on one of those binders, I might consider a low potassium diet. But for the vast majority of you, unless you've got real serious K problems running in the 6 range or more, and you can't get it under control, you probably should be on a low K diet. But that's going to be the very small percentage of you CKD folks out there. And I would guess that so many of you have been told CKD, stop the potassium. Wrongo. Why not restrict potassium on all of your viewers with CKD, James?
it's good for the heart. We just don't
It's
want it to be
all
too hard,
all kinds
or
of
we don't
good.
want to be too high.
Okay. Most patients should be on what Jen talks about, and you guys talk about plant-based diets. Now, you look at my book, and I call it my smart diet, and I'll tell you why. It's basically a type of Mediterranean diet called the DASH diet, which is emphasizes the low sodium.
Mhm.
These are all very similar diet. They're all plant-based. Um, the low sodium is important. I think, for the viewers that are concerned about declining kidney function, if you're on a low sodium diet, the Aces and the Arbs, the drugs that are going to decrease the urine protein, will work better on a low sodium diet, which is about 1,500 milligrams of sodium. So now we're going to give a list of why plant-based diets are good. What will they do for you in terms of your medical situation?
In terms of your medical situation,
Mm-hmm.
I am not sure what the answer is.
You just give me anything.
Well, they're easier on your body. They're going to be healthier because it's more natural stuff, and all that's chemicals and artificial things and preservatives and all that. It's easier on your kidneys to process the plant-based protein.
So far, so good. Okay.
Yeah, plant-based phosphorus you don't absorb as much as the artificial, which you absorb pretty much 100% of. So that's
Good.
it's good for helping you control phosphorus.
Good. Good. Well, I'm going to give the big ones. The first one is live longer. Hello. I think most of us want to live longer. Most of us. There are going to be some people that are not. But the vast majority of us, and I would guess anyone viewing your show is viewing it because you want to be healthy, you want to live longer. Plant-based diet will help you live longer. Don't give it up because your K is slightly abnormal. Do not give up plant-based diet. Decrease obesity, decrease diabetes, decrease your blood pressure, decrease your risk of the things that we talk about with the big word, atherosclerosis,
Arthrosclerosis.
cardiovascular disease, decrease your strokes, decrease the heart attacks, decrease the problems with blood supply to your legs, the blood vessels of your legs. And I recently had a friend who actually passed away due to no blood supply due to atherosclerosis of his entire aorta, which was blocked, and cut the blood supply to his legs. And anyway, this stuff can be very, very serious. Plant-based diet will help. And it gives you a lower stroke risk, lower kidney stone risk, and it can slow the loss of kidney function, maybe from the potassium itself. So potassium not only should not, should you say don't avoid potassium, but potassium may be good to slow your kidney decline. Okay. And plant-based has more fiber. And of course, fiber does all kinds of good things like decrease colon cancer, decreases irritable bowel. So you want to try, and I'm not going to get into details of diet. You want to do 4 or 5 servings of fruits and vegetables. You want to go to the produce section and get the raw stuff and not get the processed stuff, because all that processed stuff, which may say, oh, healthier, good for your diet, no fat, it's all nonsense. All the processed stuff is essentially poison, and most of what we eat is poison. And if you can stay with as much of the natural foods as you can afford, because some of them are expensive, you're going to live longer. And these natural foods don't have added sugar, which is another thing which is bad for you. You need adequate calories and protein. We won't get into the protein story, but just in general, relatively low is good, 60 to 80 grams for both diabetics and non-diabetics. And we know pretty well from lots of evidence that the high protein in meat-based diets is going to increase the rate of loss of your kidney function. You want to slow that down, stay away from the meat, especially the red meat. Higher intake of red meat correlates with more kidney failure, more patients that are going to go on dialysis. And the fiber in your diet will decrease your risk of kidney failure. and it decreases all-cause mortality, decreases the atherosclerotic cardiovascular disease. We also mentioned colon cancer, irritable bowel. So you want to try to eat the whole grain, stay away from the processed foods. Okay, we're not going to spend a lot of time on diet tonight, but I want you to consider where diet fits in, and potassium is part of this diet, where the plant-based diet fits in to your trying to live longer. It's just one factor, right?
Mm-hmm.
What are the other ones? And we talked about effect size, and I'm going to get into something really important that you're going to be happy about, James. I think I sent you a link to it.
Yes. Oh,
The fact
yes.
the fact that recent evidence and more evidence is showing that all of you folks out there that are on diets, and diets are just so prevalent, you are not going to live longer by going on a diet. Hello, there are other things that are much more important. Just like everybody with CKD doesn't need to get off potassium, get off plants. Losing weight is not the key to longevity. There's no evidence that weight loss will increase your longevity. On the other hand, plant-based diet, there's lots of evidence it will increase your lifespan. It will lower your cancer risk, lower your risk of atherosclerosis and death. And exercise. So these are things that are clearly, I mean, plant-based diet is important, and it's just one of the things in terms of lifestyle. But these other things like exercise, which has clear benefits, clear longevity benefits, live longer with exercise more, less dementia if you exercise more. James, what percent of the U.S. population has a BMI that's theoretically normal? And that's another thing we need to get
Ooh,
away
very
from.
low.
Yeah, yeah. Less than 1 in 5 people have a BMI that's normal range. I mean, but the BMI is nonsense because so many people can have a normal BMI but have terrible health. And you could have a high BMI and have pretty good health. So you really need to look at the markers of your health, like your cholesterol, like your blood pressure, like your lifestyle issues. I mean, look, there's no question that those of you who are really overweight and really heavy, if you can lose weight, and we don't have time tonight to get into it, but if you are so-called morbidly obese, BMI over 40, the bypass surgery, and even some of the drugs that we discussed on a previous talk here, they may make sense for those of you who are really very large, because you may have less joint pain, you'll have less sleep apnea, and if you need surgery, you'll be a better surgical risk. But going on diets is not going to change the major markers of predicting good health and longevity. And there was a study of 150,000 obese people followed for 10 years. Less than 1 in 100 can get to their BMI to a normal, theoretically normal level. It's a fool's errand. Why is it a fool's errand? Because when you diet, what happens to your metabolism?
It slows down.
Right, right. And if your metabolism slows down, you're not burning as many calories. And what happens to your hunger? It goes way the heck up. The body is trying to maintain itself.
That's why diets keep going up and down, up and down, up and down, up and down.
It's useless. It makes no sense. Get rid of your scales and focus on your behaviors. I think that's the best advice that anybody can give you. Focus on the things we just talked about, getting your blood pressure under control, getting rid of the cigarettes, getting adequate sleep, eating a plant-based diet and exercising, and trying to reduce stress as much as possible. That will get you living longer, not getting on the scale. The scales are going to give you stress, and they're not going to add longevity. Okay. So yeah, I think that was an important pitch that I thought we'd make tonight. Um, when do you know if a plant-based diet's a problem? If you're at risk,
Would it be if you're low in a number of areas?
low what?
I like low potassium, low.
Is that going to be a risk to be on plant-based? I mean, is plant-based diet high in potassium?
Yeah, it is. There's plenty of
Right.
potassium in it, so it's probably
Exactly.
not going to happen.
Yeah. A plant-based diet is relatively high in potassium. That's why we're talking about tonight. And a lot of folks worry about their, hey, I can't stay on plant-based diet because I got an EGFR of 30. No, ridiculous. Plant-based diet may be good for you. It may slow the decline of your kidney function. It may have other benefits that we talked about. But how do you know if your plant-based diet is starting to be a problem?
I do not know.
Yes, you do, because you told me this once before when we had one of our other talks. You get a blood test.
Oh, okay. Yeah, yeah, yeah. I was
You'll
thinking,
know.
trying to think of a symptom or something. Like, what kind of symptom? I don't know.
You get a blood test, like James got, but don't necessarily, you know, get uptight about one blood test. You might want to repeat it. But yeah, if your blood test is normal, okay, keep going on that plant-based diet for sure. If it's starting to get elevated, well, then you need to start getting concerned about how to lower it and do some of the things we just talked about. And like I said, repeating values is always a good idea. Can't tell you how often people's kidney disease has been cured when you repeat the EGFR or whatever test you're gonna do. It varies a lot. So get a trend, get a repeat value. Let's spend a little time on low K, which is not as big a concern for a lot of people, but it is just as common as high K. Um, what level again to worry about of potassium on a low side?
So, was 2.2? Is that what you said was the bottom?
Below 3. Below 3 is
Oh, below
serious.
three.
So 3.5 to 5.2 is the normal range. If you're getting below 3, you can start having problems. And what's the most common cause? This we should be able to guess the answer. Most common cause of a low K.
You're going to pee out too much. Is it from taking
Yeah.
diuretics?
Yes, you got it. I knew you'd get that one. Excellent. Good work. Commonest cause of low K is diuretics. And a lot of folks that are on diuretics, their potassium may well be low, and their doctor may well put them on potassium chloride, a common potassium supplement, which they may continue it even though they put them on other drugs that raise potassium, like Aces and Arbs, and then the K gets to 6, and they go, well, let's see, doc, I don't know why my K's up. Well, you're still taking potassium chloride 3 times a day. Maybe you should stop it. I tell you how often I've seen it. It's uncanny. Um, what causes low K? What are the common situations that people run into when their K is going to drop besides the diuretics? Clinical situations.
Does a heart attack reduce it?
Not really,
Okay.
James. It may actually increase it. But what could
Uh,
reduce it is a common thing that happens to people that get sick: diarrhea or vomiting. You
because you're
lose
getting
a lot.
dehydrated.
You get no. You lose a lot of not just
Or,
dehydrate, not just the
yeah.
volume, but you're losing electrolytes. And most people don't need to get the drinks with the electrolytes. But if you are vomiting for more than 24 to 1 or 2 days, or you're having severe diarrhea for more than one
Yeah.
to 2 days, you probably need to get checked. You need to get checked because your potassium could easily be low.
I wish I would have known that a long time ago. Because when my kidneys were failing, it was like, I thought I had food poisoning for almost 2 weeks. Nothing would stay down. I was able to drink sports drinks. I tried eating crackers, and it just seemed like everything came back up. And that's probably part of the reason mine was so low.
Yeah, absolutely. Yeah, and your medical situation you're describing is quite unusual. So I won't digress too much on that. But let's get back to What else causes low K? Severe marathon runners. They may need, Gatorade, something with electrolytes. Most of you don't need it. Most of you, normal diet, you drink enough fluids, you're going to get enough potassium. But if you're having vomiting diarrhea, you need to get it checked. And sometimes people taking too much insulin can drop their potassium. Remember, I told you insulin pushes it back in the cells. And if you're on steroids, corticosteroids, that can result in a low potassium. It's unusual unless you're, unfortunate enough to be in a country where a lot of people are starving. It's very rare to have diet-related low potassium. So what happens? Okay, so you know what happens when you have low potassium. So what are some of the symptoms of low potassium? You've probably given a lot of them.
Well, I'm not sure what was low potassium, what was what, but I had the blurred vision, I had the uncontrolled blood pressure, I had the headaches, the vomiting, the diarrhea. I couldn't sleep. I just had a cough that wouldn't stop. I had everything you can imagine going on.
Yeah, but you also had kidney failure.
Yeah. So I don't know which ones are from the kidney failure, which ones were related to the potassium being so low.
The common things that happen when your potassium is low is you feel really tired.
Oh, yeah.
You may have tingling or numbness. You may get something as simple as constipation. Because again, muscles are not going to contract as well. And if it gets real low, like where James was, you can start getting muscle cramps. You get muscle weakness. You can even get paralyzed. And you can get low blood pressure, James. Low potassium can cause a lot of peeing, a lot of increased urination, and with that, a lot of increase in your thirst. And it can result in, heart rhythms, very fast heart rhythms. So those are some of the things that happen. We're not going to get into a lot of foods, but I'll just mention a couple that are high in potassium that you may want to avoid if you are one of the high K folks, or you want to get your K up, or if you're a low K kind of problem patient. Avocados, bananas, beans, all the beans and peas, bran, the leafy greens, peanut butter, potatoes, spinach, tomatoes. I'm going to leave that to Jen. But we were going to spend some time to answer a few questions if we got any, James, or if you have any.
We got questions. So I'm gonna start way back earlier. Beverly asked, "What is a bun creatinine ratio at 33 mean?"
Okay, that's a very good question. So we don't. Where do I start? The BUN is called the blood urea nitrogen. So one of the things that the kidney gets rid of is urea. And if the kidneys aren't working so well, you get a higher blood urea nitrogen, or BUN. Now, the creatinine is a marker of kidney function. It's just a marker. And it has to do with your muscle mass and your kidney function. Okay. And there are things like dehydration that will markedly affect your BUN, your BUN. And what happens if you get dehydrated, the body's going to reabsorb more of that urea that goes to the kidneys. So the BUN is going to go up. It's a common situation in dehydration. The BUN is up versus the creatinine. That's the commonest cause. There are lots of other causes, but the main issue about BUN is in the past, people used to say, hey, my kidney function is abnormal because my BUN is 200. The normal is 10. And you can have people with a BUN of 200, normal 10, with a creatinine of 3, normal is 1. So, the BUN's up 20 times and the creatinine's up 3 times. And so there are things that are not related to how your kidneys are functioning that can raise the bun way out of proportion uh, to the elevation of the creatinine. And so bun is not a great marker of kidney function. It's something for kidney docs and other people that know how the kidneys work to be aware of. So it's a good question. Main
All
thing
right.
is don't report your bun as a measure of your kidney function. Creatinine is the real and the EGFR is an estimate, the estimate of your kidney function.
Yeah. For anyone new out there, creatinine is not the problem. So
Right.
we're
It's
not
not.
focused on lowering creatinine.
It's just a way to estimate your kidney function.
Yep. So
Like,
here's what I definitely wanted to get you to answer. Chuck, who is 63,
mhm.
his GFR is 50. His doctor says it's okay, no problem, not to worry. We'll test again in 6 months. And Chuck's asking, is that okay?
How old?
63.
Okay. Yeah, I mean, it is okay. You may or may not have CKD. In order for your doctor, and your doctor may be right on about this, hopefully he or she's aware of how we diagnose CKD. One value doesn't do it because, as we've said on this show many times, your value may be 50 today, maybe 60 next week, maybe 40 the next week, or maybe in some cases 50 today and maybe 80 next time. So you need to get a repeat measure at least 3 months apart and show that that level is staying below 50. If it's staying below 50, then you want to know about kidney stuff and look at watch some of these shows, Dadvice, and or get my book.
And I'll tell you, if I was 63 and my GFR was 50, knowing what I know now, I would not be worried. I mean, check and see if I have any protein in my urine and keeping an eye on things and just living as heart healthy of a lifestyle as I could, getting rid of all the bad habits. All right. E Little asked, how is there a way to stop the fast change in potassium?
Well, yeah, but not taking potassium. Uh, I mean, the only way potassium will change really quickly is, and you guys have heard about earthquakes. I mean, there's been a recent one in Turkey and Syria, and I was involved with an earthquake in Armenia way back when. People that, that have crush injuries, they crush the muscles. Potassium's in the cells. Crush the muscles, potassium will come out of the cells real quickly, and that can be very dangerous. And it could also give you kidney failure. So it's that or somebody getting potassium intravenously is the only real ways for your potassium to go up quickly. It's not going to happen with your diet. It's unlikely to happen with any of your medicines to go up real quickly. So those are the two ways it'll happen.
All right. Now, I hope I'm not butchering this name. Claudette says she's stage 4. Her GFR is 18. Should she be worried?
Well, Claudette, I hope that you get a chance to look at my book. And I talk a lot about things that you should be considering. And, it depends on your trend of your kidney function. If your kidney function is 18 and it's been 18 for the last few years, and depending on your age, older folks tend to have stable kidney function longer. Uh, you may not need to worry about dialysis or transplant. On the other hand, if you're at that level, and you, especially if you got protein in the urine, and you're a relatively young person, you need to start getting educated about the ways to treat end stage kidney disease. And you also need to be sure that you don't allow your doctor to talk you into starting dialysis early when there's no early, meaning over 10. In some cases, they're even doing it over 15 EGFR. You want to discuss, after looking at lots of information in my book, and bring it to your doctor, you know, why they want to start you, and And think about the options. If you're, if you're a younger person and your kidney function is declining, you would need to consider getting a kidney transplant. That should be your first choice. You also may want to learn about doing dialysis at home. That would be the second choice. And I discuss all of that in detail in my book, in great detail.
Very good. And Kathleen says she's stage 4 GFR 26, and she's just been prescribed potassium citrate to lower her uric acid. Is that going to raise her potassium levels?
You got it. Okay. First of all, potassium citrate has nothing to do with your uric acid level. What I'm guessing here, if you've got, first of all, potassium citrate is used for kidney stones. And if you've got uric acid stones, you want to alkalinize the urine, which would mean giving the sodium bicarbonate. So I'm not sure. I think you've got something mixed up, and I would get your doctor to explain why you're on the potassium citrate. And I don't think it has anything to do with the uric acid, because that's not a common way to deal with uric acid stones, which I just doesn't really make sense to me. They're not connected. They're not related.
Yeah, and I'm hoping her doctor prescribed that. I do know that one of those channels that posts 3 to 5 kidney cures a week does push taking that as a cure to kidney disease and says it cures it in 2 weeks.
Oh,
So
that
that
is
woo woo.
citrate.
Yeah, well, there's one channel
Wow. Ooh.
of a person who's hired from Fiverr, puts on her lab coat, pretends to be a doctor,
Oh my
and
God.
posts
Oh,
all
that.
these fake cures. And hopefully that's not what she's following. Hopefully this person's following, got that prescription from her doctor.
Yeah, I mean, potassium citrate in somebody with advanced CKD could really be potentially fatal. If your potassium is running high and you got stage 5 or even stage 4, possibly. No, that's not a good idea. So you need to get somebody to explain what's going on with that potassium citrate.
And another one right here. Can you tell me if Ozempic is okay for kidneys? And I might have butchered that medication.
Yeah, that's the weight loss drug, and I think it seems it's expensive. First of all, I think it's about $1,000 a month. I think if you are, and it works, and whether or not there's going to be long-term problems with it, and whether there's going to be a long-term problem for the kidneys with it, we don't know. It's not been out long enough. If you are a patient that has, let's say, morbid obesity, certainly anybody who's up in the 40 range BMI, the drug makes sense because the risk benefit is for the benefit. And it may turn out to be very safe. It does work. It does work. Yeah.
All
And
right,
I don't
Jeff.
know if it's having an adverse kidney effect.
And we're almost out of time, so I'm going to squeeze one more in here. Jeff says or asks, does it make any difference how someone acquired CKD as on what you do for treating it?
Oh, absolutely. And look, we don't talk much about the main causes of kidney disease are diabetes. Okay. That accounts for roughly half worldwide of people that go on dialysis. Theoretically, diabetic related kidney disease. Blood pressure related kidney disease is another 20 to 30%. So that's the majority are thought to be connected to your blood pressure and or your diabetes. It and then there's lots of unusual causes of kidney disease that are related to many other diagnoses, including polycystic kidney disease, which accounts for about 1 or 2% of people on dialysis. And then there's all the glomerular diseases. Some people with high protein in the urine need to get a kidney biopsy to see what type of glomerular disease they have. And those types of diseases, according to the biopsy, have different ways of treating it. For diabetics, if you are a younger diabetic, tight control of your sugar, insulin pump, if you're a type 1, may slow or prevent kidney disease. but there's a lot more to discuss. That's a complicated question, but a good
All
one.
right. We are out of time, Doc. Thank you so much for all this great information today. And I was so excited that you did mention that weight loss is not, like that key, it's not a key priority to be focusing on. There's so many other things we should be doing to help live longer and slow the progression of our kidney disease.
Yeah.
And for everyone else out there, thank you so much for joining us. Please share this video. Give it a like, give it a thumbs up. Continue to put your comments down below. I go back a lot of times and I'll go and I'll read comments and answer some of them if I can. If you're looking for Dr. Rowe's book, the title is Learn the Facts About Kidney Disease, and you can get it on Amazon. I got a link right there, go.dadvicetv.com/book. Will take you right to Amazon, or you can go to your local favorite mom and pop bookstore. They can order a copy for you. It's very affordable. It's very easy to read. You do not need a medical degree to read this book. It is written for the average person. Did you want to add anything to that, Dr. Rowe?
No, I mean, look, and I think anyone who's been diagnosed with CKD that really has CKD and listen to our Dadvice talks on CKD3 to learn whether you really have it or not, I think you can benefit by reading the book if you have CKD, especially if you've got stage 4 or 5 and there's a consideration of dialysis. That would be especially the group that I would strongly urge you to get a hold of the book.
Sounds great. Well, thank you very much, and thank all of you out there. Dr. Rowe will be back on May 22nd. He's going to go travel the world for a little bit and then have a great time. And then he will be back here May 22nd. All right, everybody. Thank you so much, and we'll see you guys in the next video. Bye, everyone.